Hey everybody, it's Dr. Eric Balkavage, and I'm joined by, as usual, Dr. Erica Riggleman, and we're back for another episode of Thyroid Answers podcast. And today we are going to talk to Dr. Leah Austin, who is a medical doctor who's across the pond, shall we say. And we're gonna have a discussion about really the challenges sometimes that arise when somebody who's used to medical type care starts getting involved in functional medicine and reading about functional medicine, wants that functional medicine approach, but then goes back to their classic allopathic medical physician and expects them to provide functional medicine care, and they're not necessarily prepped or prepared. So we want to help some people with some of those challenges and frustrations. So Leah, welcome to the podcast. How are you today?
I'm good, thank you. Thanks for having me here.
Awesome. So first thing you typically like to do is give our listeners a little bit of background about our guest. So can you give us a little bit of background? Because as a traditional medical doctor, functional medicine is usually not part of the picture, but somehow you went and brought this functional medicine piece into your practice. So tell us tell us your story, your background, and how you got involved in functional medicine.
Okay. Well, so my name's Dr. Leah, and I'm a general practitioner, which is considered a family physician, I believe, in the States. And I work in the community and manage patients' healthcare. So in the conventional medical role, patients would come to me, I would also see their families, and I would be their general practitioner or their family physician. And if they had a problem that I couldn't solve, then I would refer them on to onto secondary care, where they would get a specialist physician's input. So if you had a gastro problem, you would see a gastroenterologist. If you had a respiratory problem and I couldn't manage it, then I would send it to a respiratory physician. So I would get to a certain level of care, and then if I can't manage it, then I refer them on. And I started studying medicine in Newcastle University in the UK, qualified as a GP there as well. So after my training, I went on to study general practitioner training, which is about 5 years. After that, I had a bit more free time because going to medical school is very intense. You get caught on the treadmill, and you have to study the hours, and you get taught what they teach you. So you do what they do, you do the clinical experience. So it's quite a stressful time. And then when I became a GP, I thought, great, I'm finally there. I'm finally there. But you actually only start gaining your experience, even though you have been a doctor for how many years before you get there. And I started learning about my own health. And I was actually freelancing. I was locuming for the NHS, and in the NHS in the UK, we only have 10 minutes or 10. Sometimes they stretch to 15, but generally 10 minutes per consultation with patients. And I found that the training was very good. I got ticked all the boxes, and I was able to consult with patients in 10 minutes because that's what they teach you. They teach you how to get all the information out in 10 minutes, certain communication cues and things not to miss, and what, underlying red flag symptoms. So I can go tick, 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 and then get them out the door. Now, as I became very good at acute medicine, if someone had a urinary tract infection, or if they had a cough or they're cold or tonsillitis, fine, easy to manage. But when I had somebody with multiple medications, multiple problems, I found that 10 minutes very, very hard to get them in and out the door. And when I was, researching about my own health, thinking, okay, well, I'm locuming, I'm freelancing, the paperwork is less because I'm only locuming and freelancing for a practice. So I don't have the same stresses as somebody who's there regularly. My paperwork gets picked up by one of the other doctors that work there regularly, which is, kind of cool. But I started working on my own health, and I was starting to prescribe things where I was thinking, I wouldn't want to take this type of medication. There must be another way. There is another way. I'm sure there's another way. And the more I learn about my own health, the more I started to explore other avenues of understanding, is there another way, or am I just giving them another thing like medication to take one problem away and give them another? So with medications, there always comes side effects, as you probably both well know, you know. And I was seeing these patients on multiple medications, and you get to the point where I would see a patient and they would have high cholesterol, and I would want to go, well, I'm sure this is down to something more, because I don't think this is just genetics. I'm sure this is down to something more that's going on in your life, but I can't, at 10 minutes is not a long time to address it. And you can say, go away, eat more vegetables, come back and see me, we can check it again in 3 months' time. And you would see a trend in 10 minutes. That isn't long enough to change someone's ideal of life anyway, of what they should be doing and shouldn't be doing. Plus I didn't know what they shouldn't be doing. And, you know, they would come in and all I would be, you know, I'd look at the guidelines. The guidelines are, okay, well, they've got a little bit of high blood pressure, or they've got something else going on. Maybe start a cholesterol tablet, you know, a statin. And that would be an example of where I'd be like, well, you know, I could start a statin, but they've got all these side effects. And we'll have to check your liver function in a couple of months' time, see if your liver enzymes go up, because sometimes it can affect your liver. But you have got high cholesterol, so, you know, this is the current guidelines, and this is the evidence. This is how it's going to improve and reduce your cardiovascular risk factor, say a heart attack or a stroke. And you have to take it for 10 years because that's the evidence, and it's going to reduce your risk by a quarter. So you're not going to be, you're basically, you know, how it works with, this is medication. So I'd explain that if 100 people took the statin, your risk factor was 10%, 100 people would have to take it, and it will reduce the risk factor by a quarter. So then, you know, 8 or 7 people would get a cardiovascular problem, and those 2-3 people would be safe, because, you know, the statin helped bring down that risk factor. And that's very much how it's done and how we're taught about the evidence. And I just felt that there must be another way. So I went to study naturopathic nutrition, and I did that for 2 years. And then I started integrating functional medicine, because naturopathic nutrition is very much finding the root cause and looking at the whole body. And it is definitely the functional medical approach of looking at it systematically, and systems under stress and causes and triggers, and then going on to explain that to the patient, and then moving on to what can we do about it. And after learning about that and then integrating in conventional medicine, I just found I started to love chronic health problems. And I hated chronic health problems because I didn't know what to do in the conventional medical role model, where you say, okay, the next step is a medication, but then the medication might not work, or the patient might have side effects and might give them another problem, or they end up on multiple medications. So that's kind of, in a very quick nutshell, of my background and my story. But, you know, we haven't talked about my own health problems on top of that.
So would you say that, you know, I in the past, I worked in the medical world for a while, and then came to this kind of functional medicine type of practice. But I understand the model. I was a little bit more critical when early on, because I was frustrated with the model. But now I've softened, you know, kind of my thought process on it. And I think where medicine, traditional allopathic medicine, shines is the acute care model, crisis model, where, hey, I'm in crisis, and you're gonna advise them on something that they need right away to kind of to address or manage the situation, is probably the better word. Mm-hmm. But I don't think, and I think you pointed this out, that it's really well equipped to really dig in and address the root cause issues. There's a huge benefit to it from that crisis care point. The issue is we went from using allopathic medicine for crisis care, and somewhere along the line, we just adapted it and said, we're just going to manage these conditions in the long run. And there really isn't a really good set of tools to help people recover, right? Regain their health And really what was happened from my perspective is doctors are doing their job. They've just been taught that these are the body's breaking down and we're just going to manage their signs and symptoms for the rest, for their duration or the rest of their life. And as you said, it's the downside to that is we probably are never addressing the root cause issues. Two, we are managing lab values to make us feel like, hey, we're creating benefit. But then we've got, as you explained, the downside, which is the unintended consequences of a medication creates side effects that we now need to manage, and we maybe contribute to the issues. And so I think that's where we really have a struggle, is we have to help people both from a medical perspective and from the functional medicine perspective that allopathic medicine is not bad. Functional medicine isn't bad or good. Allopathic medicine isn't bad or good. But I think that each really have their place. And if we as the physicians can start to understand that, hey, let's rule out if there's pathology that really needs crisis care, if we need crisis management, allopathic medicine really shines there, right? But if we're really trying to, once we got our patient stabilized, then we got to really start to help them figure out, okay, what caused this? How do we get the person to recover and get back to a state of more optimal health than just managing their disease and their crisis as it continues to get worse? Would you agree with that?
Definitely. I think that I think it's important, the conventional medical, obviously the training, I can make sure that there's nothing more sinister going on, at least initially, or red flag. So red flag symptoms would be, if you were having weight loss unintentionally, or a fever of unknown origin, or passing blood in your urine or your stool, that's when you kind of need urgent medical attention that you need to stop, or an acute abdomen, so you might have appendicitis or something like that, which is so important because you don't want to miss something that needs to be treated urgently. And medications also have its role, because you're right, I think if somebody came to me and they had initially a problem and I say, well, actually we need to put some sort of bandage on that, and medications I feel don't really, well, they do treat in some aspects, they do, because they antibiotics and infections, but if you're getting recurrent infections or it's a chronic health problem and you need that medication just to dampen that effect of whatever illness you have, or just help manage those symptoms to live some sort of quality life, then it's so important to have those medications. But then it's also important at the same time to address the root cause, so that you can then eventually get off that medication if it's possible, because otherwise I think that I'm seeing more and more now, more and more patients be on multiple medications, and they all interact between each other. And then you don't know what's going on in the body anymore, because this is putting that out of balance. This is putting another thing out of balance. But yeah, it's taking that away, but it's giving you, so it's giving you another problem. And then another medication is doing exactly the same. And they may interact a little bit as well. And then it's just like, well, I don't know really where to start at all, because, you're on so many medications, and they're all going to have some sort of effect on your body. And do I need to add another medication to balance something else out? And, then where do you go from there?
Yeah, I think that part of our problem in our healthcare system is that there isn't that collaboration. There's a huge rift between the allopathic medicine and, holistic functional medicine, that, people often are like, I want one or I want completely the other. But really, for real health and management of issues, you really kind of need both. You have to rule out the really critical stuff. But then on the backside of it, if it's something that's more chronic and long-term, you have to ask the right questions of why is this going on? And I think that if there was more collaboration between the two sides and more acceptance, I think that people would, be better off in our healthcare systems. But right now there is such a divide, and, the two sides, for whatever reason, don't want to collaborate. They feel like they're stepping on each other's toes. And then you get people who want functional medicine for, things that that's not what functional medicine is for. You need acute care, but they don't want to go to that side. So I think that there definitely needs to be more of a mix. And I think that that would overall do our healthcare system a great benefit.
Yeah, and I think the other issue is, and I kind of guess that kind of leads us into the next question is that in a functional medicine practice, we are often spending a lot more than 10 minutes with the patient. And to the allopathic physician's defense, you can't really do what we're doing with functional medicine in a 10-minute appointment. You can't assess really do a really good job of figuring out what's going on with their signs and their symptoms. You can't really get into their health history in depth. You can't get into their dietary issues in depth, their emotional stressors, their sleep pattern. It's just 10 minutes is just not a sufficient time. And I get it. Here in the United States, the doctors are under the same thing. They've got a schedule that they're expected to keep. What's the signs and symptoms that need to be treated now? Do their medications need to be changed? Do we need to add one? Boom, we're out the door and going. Because really the focus is on managing those signs and symptoms, versus in functional medicine, we're really trying to spend a bit more time, help almost be like the coach and help them figure out what's going on in their lifestyle and in their habits and their behaviors that's actually creating part of their health crisis. So let's kind of get into this a little bit. Now you're allopathic and a functional medicine practitioner at the same time. What do you think are some of the big challenges that you see as people coming to you with, I guess, first of all, as a medical physician, and their expectation is probably medical treatment? How do you work with those people to get them to kind of shift their philosophy that, hey, maybe there's things that we can do here naturally, or more from a functional medicine standpoint? How do you help them with that transition? Because for Eric and I, it's a different thing, because they've already been frustrated by that model. And so we're getting them further downstream. You're getting those people who are used to a medical model, used to that type of care. And now that you're doing functional medicine, you're going, hey, I don't want to have to give you a statin because the statin will suppress your cholesterol. But maybe the root issue of why you have elevated cholesterol is because you have a thyroid problem. And maybe we need to address why the thyroid physiology is struggling. So how do you work with that transition for your patients?
That's such a good question. So as soon as I qualified as a naturopath, which is a little bit of background, I then started practicing more privately in the UK. So I now have an hour with my initial consultations and half an hour for follow-up. And that's the usual kind of timing. Some people need more time than that. But I work through a kind of a hospital as a practicing privilege. It's still a GP, still a general practitioner. So I still manage people's healthcare and whether they need referrals and things like that. But when somebody comes to see me, they might just be, asking for just a private GP consultation, and that's absolutely fine. But it's then if I see something, because some people live life and they don't have any problems whatsoever, and it's great, it's amazing. I'd love to be one of those people, but some majority of people don't, or that I see. And we go, I will take them through the normal conventional medical roles. So I'll take all my history taking, do probably extra questions. So I'd ask them a bit more nutrition and lifestyle questions to understand their sleep and their digestion, because that's so important. And understanding, where they're based, what their work-life balance is like. So I get a full picture of what's going on, as well as their medical history and medications and any vitamins they're taking, anything like that. And then if I do think that there might be something in their lifestyle or they're lacking in their nutrition or something like that, I'll put it in a way that backs it up with evidence. So I'm, saying if they're vegetarian, I said, well, that's interesting, and how this could be having an impact on their body, and what could be going on physiologically, given what their symptoms are. And then I'll relate it back to the way they're feeling and their symptoms, and explain how and why it is likely that this is going on. And I honestly believe that that really helps, because it puts them in a perspective and that people can understand. And then also it plants the seed of, oh, is that why? Is that why I'm feeling that way? Or, oh, I never thought about that, you know? And you can see the clogs moving and people really responding well to it. And
So
you know, go on. Yeah.
So do you think that, because the argument sometimes is that, listen, people don't want to change their diet, their lifestyle. They don't want to do anything. They just want a medication that's going to fix their problem initially. And while there are people who guaranteed that's what they want, now that you do functional medicine, you're trying to help people see that diet and lifestyle factors play a huge role. Do you find in your practice that the people that come to you for maybe traditional allopathic care are open to the concept and willing to change some of the aspects of their diet and lifestyle, and more receptive to it now because you actually have the time to explain it to them?
I would say 90% are, maybe more, 95% even. It's that one person that doesn't, which is absolutely fine. But I've still planted some sort of seed. So they'll go away and they may think about it a little bit. And I always check, are you interested in this? Are you interested in vitamins? Are you interested? You know, if not, absolutely fine. I can do the medical stuff that you want me to do. I'm happy to do that. And actually, it depends where you are in that life cycle change. But honestly, it's very receptive, and most people are, you know, whether they decide to change or not, it's their decision. You know, it's their autonomy, it's their life. But at least they have all the information. I can go away and I can feel, okay, well, I feel like I've done my job, you know, because that is my job. My job is to explain what is out there and what's available and why something is going on. So I do find it very rewarding.
I think that planting the seed is really important. I think from my perspective, some of the struggles that I see when people come to see me is that they've been told by their general practitioner that, oh, no, it has nothing to do with diet, or this, you know, just take this pill and, you know, it's all taken care of, or you have diabetes, you don't need to work on your diet, you just need to take your metformin today. And so they've kind of already had that their seed was planted that stuff doesn't matter. So I'm trying to explain to them a whole new concept that they're not even open to, where you're just kind of planting a seed where they may go, that makes sense. And then they may want to learn more. But when they come into it already closed-minded, from my perspective, from patients coming in, that's a little bit frustrating. So I think that's awesome from a general practitioner side of it, where you're actually just planting the seed, and it may make people more open to those changes. I think that's awesome.
Yeah, and let's take the other side of that coin, right? Because you see this now as a functional medicine practitioner. I'm sure some people actually seek you out now because of your unique approach to it. But I'm sure that as a traditional allopathic physician, and some of your colleagues probably to some degree have a level of frustration, as do patients who learn about functional medicine, who read blogs, who read articles, and they come to not you per se, but they come to their typical GP allopathic physician and say, hey, I want these tests done. I want you, and when we're talking about thyroid physiology, you know, the traditional test is a TSH and maybe a reflex to free T4. But then the patient who's learned about functional medicine comes to you, or you're a colleague of yours, right? And says, but I want a T4, T3, free T4, free T3, reverse T3, thyroid antibodies. I want all of that done. And they're told it's not needed, it's not medically necessary. So I'm sure this has happened. Can you explain for the listeners, why a medical physician might say, if we use the thyroid panel as an example, why TSH is maybe the only test, or free T4 is needed, why those other tests are not maybe considered medically necessary, or the doctor may not feel comfortable running those tests?
Well, I think in the UK it's easy because it's a budget. it's definitely a budget thing more than anything. I mean, also, you know, majority of the people, they say that, well, if the TSH is normal, and they're right to a certain extent, so it's a numbers thing, then the likelihood is the T4 is probably normal. And it's very rare that you would, in the NHS, that they would actually also check T3. I mean, in private practice, though, if a patient really wanted those tests, I'm pretty sure that any private GP would be like, yes, no problem, because they're mainly self-funding. So then it's like, okay, well, yeah, I can see the benefit of maybe why we would get these and what with your symptoms and correlation. So let's do them. But in the NHS, I would say that the majority of people with the TSH and being normal, and also a money aspect, financial aspect of strain on a national health system, then, you know, they say, well, TSH is enough, because as I think, as you've explained probably in your previous podcast about TSH and where it comes from, and the loop between, you know, the brain and the thyroid gland, it, you know, communicates back, in theory, communicates back to the TSH. So in theory, they should be communicating. So if the TSH is normal, then in theory, the rest of them should be normal. But we know in practice that doesn't always play to that.
Yeah, so for the listeners, and we've talked about this multiple times on the podcast, TSH is considered to be like the gold standard test to determine whether the thyroid gland is functioning well enough to put out enough thyroid hormone. And so from a medical perspective, physicians are really looking for the TSH to go high, T4 to go low, because now it's considered that the thyroid gland has become dysfunctional to a point where it can't put out enough thyroid hormone. And the assumption to some degree is that there's no thyroid physiology problems as long as the gland is making enough hormone. That's not, as long as there's enough thyroid hormone in the bloodstream to support the hypothalamus, then all the downstream thyroid physiology is going to work. But as we've talked about from a functional medicine perspective, we're clearly alert and aware of the fact that the amount of T4, T3 in the bloodstream doesn't necessarily correlate with optimal tissue levels of thyroid hormone. But that's really falls outside really the realm of what allopathic medicine is taught and what they can treat, because until there isn't enough thyroid hormone, there's not a tool in the allopathic model, and if you will comment on that, to really treat what's going on in the periphery. Do you understand what I'm saying?
Mm-hmm, mm-hmm. And also, well, you know, also in conventional, there's so much I've learned when I study nutrition about the thyroid, actually, so much more I learned when I did more research into it, and, you know, how much it correlates and is best friends with stress, and everything else that's going on in the body. And as a doctor, medical doctor, it's interesting, because when I sometimes I didn't know that. I knew not to necessarily test an acute illness, but now I know why, because stress levels go up and it downregulates the thyroid function. But, you know, before I studied that, I actually didn't know. I just, you know, would have tested, it would have been underactive. And if, you know, I might have not known that it was due to an infection or something going on chronically.
Yeah, it's probably not part of the training to assume that, hey, TSH could be suppressed into normal range or actually below lab reference range by chronic stress, chronic inflammation, metformin, number of other drugs that can suppress it. So if TSH is only run, and that's what the guidelines would say, is run TSH. If that's out of range, then we run a T4. Then it's assumed that everything's good. But unless you're getting that additional training about the things that could negatively influence TSH, you wouldn't go any further, because the guidelines say that's it. We're all good. And as long as TSH is good and T4 is good, there's nothing we have to do. We're not going to give somebody more T4 in that situation. And the allopathic model, the only real tools to address it is when there isn't any more thyroid hormone. So I think for patients here in the US, maybe there as well, that's where they get frustrated, because they hear the functional medicine perspective And they're like, why aren't you looking at what these functional medicine practitioners are talking about, the tissue level, the cellular level, what's, you know, and how transport and all these, the conversions are occurring. And to be fair to allopathic medicine, there just isn't a tool in the toolbox to address it. And one of the worst things you can do is start dumping a bunch of thyroid hormone into a system that doesn't really need it or desire it, because now you have the problem of upregulating the HPT axis, increasing more of a hyperthyroid symptomatology in the central system up in the brain, in the hypothalamus and pituitary, and then creating a bigger hypothyroid state in the periphery. So I think for the listeners, one of those things that's really important is that you understand is that from an allopathic model and a functional model, we're looking at the function and the physiology and labs from really two totally different perspectives. So when you go to your physician, it's definitely here in the United States, and you ask for tests that are not part of their training or their guidelines, or there's no treatment that they can do in regard to a test. Reverse T3 is elevated. There's no tool in that medical toolbox to, what do you do for that? Do I give them T4? There's no treatment model to address it. And so therefore it's considered not medically necessary, which is different than it being clinically important or clinically relevant for those of us in functional medicine. So I think that's sometimes where the big frustration is.
I think one of the other big frustrations is going to be the insurance coverage or having to pay out of pocket. You had said that, you know, people want more of the functional medicine stuff. It is going to be out of pocket. Do you see that frustration where people, you know, don't want to pay out of pocket to do these extra tests? And how do you kind of bridge that gap and educate them from that perspective?
Yeah, that's a great question. And actually, you did another point that you mentioned earlier about doctors saying, "Oh no, it's not your nutrition." You said that and how do you change the plant the seed of change after that? Because they said, "Oh, nutrition isn't." So just mention that, I wanted to follow up and say that I think it's the reason that people say that, or doctors say that, is because they don't want to blame the patient that on their diet, because they've been doing it to themselves. And it gives that patient blame. And I think that's why they say it. Also, some of them really believe that nutrition doesn't have an impact, which it does. So I wanted to say that because I feel like I do hear it. And sometimes I hear it from other doctors and other physicians. And I think actually, I get why you're saying that. You're saying that because you don't want them to feel bad. And I think that's necessarily a bad thing. But then it's important that they're aware that they can do things to improve their health with the nutrition. And actually, there's a lot of stuff on our shelves that should not be on our shelves to eat. So it's a mind thing. If people think, if it's available to eat, surely it can't be that bad for me, you know? And actually it is. It really is that bad for you. Anyway, well, without going, because that's a whole nother topic you could talk about. And then talking about the tests that you mentioned, that question about tests, I think that I can explain it. So I can just say, look, in the conventional medical role, it's probably not tested. But I do think for sure, the bare minimum, if it was, for example, if we're talking about a thyroid, I think bare minimum, we should test TSH, T3, T4, and antibodies at the bare minimum, I usually say. And that's actually self-funding wise, there's actually quite a good deal privately, if you know the right labs to go to, where you can get a good deal, because I'm always looking for the best value for money, especially for those patients who, you know, need that extra value. And I discuss it with them, and I say, look, this is you know, we can follow that, but then what happens if it is that's the problem, and then we do everything else, and you know, that's still the issue, and that will give us the answer. So then they get it. And then if they decide they don't want to, I can also give them a lifestyle plan without doing any testing anyway, because you can always manage somebody clinically anyway. You know, before we had any tests available, before doctors had any tests, we worked on clinical findings, examining someone, looking at them, talking to them, taking their history, you know, they do say that once a doctor gets you in the room, and they take the majority of the diagnosis comes from the history and how the history happened. So there's a lot you can do anyway without the test results, because you kind of have a hunch that that's what's going on, and I find that the hunch is usually right once you've got so much experience.
Yeah, I think once you go through looking at somebody's health timeline, their health history, you can really get a good assessment of how they got to where they are. And I think that's correct. There's definitely things that you can do from a treatment perspective to help them without getting specific labs done. And a lot of those things have nothing to do with medication or supplementation. They center around, here's what your current diet is. Here's how we can change it. And that would be more helpful for you. Here, you're not sleeping, so let's get some sleeping strategies in place. Your respiration is really high rate. You're a mouth breather. Let's try and work on those things. And that gives patient ownership of their condition as well. And it gives them some buy-in that they have to take care of themselves. I think one of those things you talked about was doctors don't want to make patients feel like it's their fault, right? It's their fault they have a health condition because of the way they eat. And I understand that perspective, and I think we just have to do a good job of delicately letting people know that your diet and lifestyle does play a significant role in why you either have really good health or poor health. And if you're not actively engaged in fixing those diet and lifestyle factors, you're going to struggle and you're going to continue to have health issues. So I do think we have to figure out a nice way to allow the patient to understand that they have ownership in the situation versus just being, the backseat passenger, and their health just goes down this path. Because I think that allows for somebody to realize that they can get better. When it's just all these conditions are happening to me and I don't have any control, then they feel like they're captive. They can't do anything. And I would rather let the person know that, hey, if you make these dietary changes and your current diet is probably part of your problem, you can see a change and improvement by just changing that. And I think that gives them power over their own health and their own condition. So I think that piece is important.
I think genetics also are a thing that people blame, that they don't want to take ownership, and they think, oh, it was in my genes, I can't change it. So yeah, that's definitely another one that can be affected. Diet and lifestyle are really what affects those genes. And so just because you have a genetic, predisposition to have some of these things doesn't mean that it's going to happen. So there are things that people can do. And I think bridging that gap is really important.
Yeah, I mean, we see people all the time. We say, I have diabetes because my mom had diabetes, and my dad has diabetes, and my brother has diabetes, and they all have high cholesterol, and they all have high blood pressure. So this is just what's going to happen to me. And that's where you have to kind of be a little bit blunt and say the more likely reason that everybody's diabetic and has high cholesterol and has high blood pressure is because of the same or similar diet and lifestyle. And so if your parents eat a certain way and you eat a certain way and your lifestyle's a certain way, then yeah, the likelihood is you're going to develop the same issues and conditions. But I think you're right, Erica, when you say that, people just think, everybody in my family is this way, so this is the way it's going to be. And again, that takes away, the responsibility to take care of themselves and the idea that they can change their destiny. They can be healthy or unhealthy based on diet and lifestyle changes. And I know those things aren't the sexy things to talk about, and they're harder to address, but ultimately it's what gives somebody the most control. So let's do this. Let's talk about, because sometimes people get a misconception of the different kind of categories. We talk about allopathic medicine, what that idea is and those principles. We talk about functional medicine, and then there's this integrative medicine. So from your perspective, how would you explain the difference? Because I have patients that come to me and they're like, they don't understand the difference between those kind of categories. So how would you explain those categories to somebody if they ask you, what's the difference between an allopathic doctor and an integrative doctor and a functional doctor?
So an allopathic or / conventional medical doctor would very much take a systems approach in the sense that the system belongs to that healthcare profession, and they would take a history and examine you and be very good at acute medicine. So tonsillitis, urinary tract infections, and they might do a little bit of lifestyle and nutrition, but very basic, just make sure you're sleeping okay, bowel movements as normal as they are to you, type questions. And they'll do the red flag symptoms very good, they'll prescribe medication, and they probably won't advise on that much nutrition or supplements or anything like that. And I would say that if you are, you need to do your due diligence on integrative doctors and functional doctors, because the term is a little bit loose, in the sense that I think in the UK, I think that this might go for the US, I'm not sure, but a lot of people can call themselves functional doctors and learn it themselves, which is fine. Experience and testing, you can do that. But you can, there's qualifications you can get, which, I studied a naturopathic nutritional diploma. Some people did Institute of Functional Medicine training. Some people went to universities and studied integrative functional medicine, or, anti-aging for medicine. There's the clinical fellowship in nutritional and functional medicine, I believe. So you need to do your due diligence and understanding, what doctor's qualifications or a practitioner's qualifications are and their experience. An integrative doctor might call themselves an integrative doctor if they work with a nutritionist, and then they'll see you and then do their medical stuff, and then they'll send you to a nutritionist, or they have an acupuncturist as well that they work with, so they might send you to an acupuncturist as well. And they could call themselves an integrated practitioner because of that, which isn't necessarily a bad thing. It's just that they still usually do the conventional stuff, and then they usually send them off to a colleague of theirs that does the nutrition stuff. Or like myself, I am a nutritional therapist as well, so I integrate my conventional medical knowledge with my naturopathic nutritional diploma information, which is practically just functional medicine, because that's the functional model they teach you. And then there's the functional practitioner, who may have done an IFM qualification or another qualification somewhere else, or just decided that they're a functional medical doctor and they've got the experience, which is absolutely fine if they have the experience and they've learned from other ways, sources, which they, usually with a mentor, or gone to conferences and picked up a lot of things and testing and understanding of tests.
Yeah, so I think from the patient standpoint, when we're talking about, I'll give you my opinion, you guys can kind of weigh in on that. The allopathic approach is really focused around evaluating disease pathology and managing and addressing acute care symptoms, drugs, surgery, those types of things. Minimal lifestyle modification. Not that that's a slight to the allopathic profession, it's just not a big piece of their training, nor do they have the time to really get in depth with that in most cases, which we discussed already. And then from my perspective, I agree that some of the functional medicine term is a bit loose. And what does that mean? Because what I often see is that we see people who take the allopathic perspective and like, okay, what's the sign and symptom? Let me give you something for that, and bring that to supplementation. And they're using that kind of the allopathic, okay, you got a headache, what can I give you naturally that may manage a headache? Or what can I give you that's going to manage your reflux or your dysbiosis? And really what I think the functional medicine perspective is, from my thoughts, is that in functional medicine, the big difference is we really want to focus on addressing the root cause issues. So if you're going to see a functional medicine practitioner or somebody who says they're a functional medicine practitioner, what you should expect is that they're going to get into the weeds with your diet, your lifestyle, your habits, your behaviors, past trauma. And they're going to use supplements not necessarily as a way to mask your symptoms or manage your symptoms, but they're going to use supplementation to help tissues respond, recover, and then you should be able to kind of start to pull that stuff away. But what I see sometimes is in functional medicine, we have somebody who's come from that mindset of what is it, I'm going to prescribe something. And we have this perception that if they're prescribing a supplement for your reflux versus a proton pump inhibitor, that because it's natural, I'm a better doctor. And I don't think that's the way we should look at it. I think if you, from a functional perspective, it should be, hey, I may give you something to help you with that now, but my job as the functional medicine practitioner should be to help you understand why you have reflux. What's driving that? Is it an H. pylori infection? Is it lack of bile, which is causing that reflux? And if it is reduction in proper bile flow, what's causing that? Is it an estrogen issue? So for the listener, I think when you're talking like, hey, I'm gonna go see a functional medicine practitioner, if the solution is I'm gonna replace your 18 medications with 18 supplements, that's not functional medicine in my perspective. That's just taking the allopathic philosophy to some degree and bringing it to supplementation. From integrative, I think what I think that should be is somebody like yourself who is saying, hey, listen, over here, I have the allopathic paradigm and philosophy, and I'm really good at that aspect of it. But I also see this functional medical perspective, right? Where I want to get at root cause. And what I'm really trying to do as the integrative practitioner is be able to blend them, but not confuse them, right? Not say, well, we're just gonna do this, lots of supplements in place. You have a cholesterol problem? I'm gonna put you on a supplement that's gonna lower your cholesterol, right? I'm gonna give you red yeast rice, and that's going to be the solution, because that's still the allopathic paradigm or perspective. So I think that really from an integrative perspective, what I would like to see from an integrative perspective, or my hope and perception is somebody like you who's got both sides of it and can say, hey, I need a little bit of this, but it's a different philosophy when we go to that functional medicine perspective. But they have the ability to say, you know what? I need to do something crisis, I can do it with the medication, or I can do it with the supplementation. But at the end of the day, if I'm really going to help you, I got to get to root cause issues. Is that fair?
I think that's a very good way of explaining it. Also, though, you know what? I believe this is medicine. You know, I think it should be integrated 100%. The way that you explained it, because, you know, we should all be getting to the, even, you know, conventional medical doctors, they should be getting to the root cause of the problem to solve it, to understand it. And at least then, you know, it's the patient's choice whether they want to do anything about it. But I think we've got a little way to go before that changes. You know, you know, doing the naturopathic diploma and, you know, the conventional medical training, or the allopathic, or whatever you want to call it, it just opened my eyes, you know, doing both. And honestly, I think this is medicine. You know, this really is medicine.
Yeah, I had a patient who I just started seeing, and this kind of gives the listeners a kind of perspective difference. You know, and we're talking about the root of their problem. They have chronic GI issues, history of you know, they've been diagnosed with IBS. And so in my assessment, I said that the root issue here is you have dysbiosis, you have poor stomach acid production, poor bile flow, you have estrogen dominance, and all this stuff ties in. So these are the things that we need to address. These are the root issues. In the meantime, they had a gastro appointment, and their gastroenterologist said, your root issue is you have diverticulitis. And so the patient was like, well, the gastro said, the reason I have my stomach pain is because I have gastroenteritis. He said, that's the root issue. And I said, no, that's what's developed because of some imbalance in the GI tract. So there's inflammation in the GI tract because of something. The diverticulitis is the outcome of that. And that's where the patient was confused. But I understand why she's confused from that physician's perspective and how they're testing. They're looking at the person saying, hey, the reason you have this pain, you have this inflammation, you have the diarrhea, the constipation is because you have this diverticulosis or diverticulitis. I get it, that they tested for the pathology, but I needed to explain to them, but that pathology wasn't the cause. That was what developed because of poor dietary function in the GI tract for an extended period of time. So that's where we have to, I think that's one of the areas where we really need to do a better job of integrating, right? To be able to say, hey, the reason your GP or your gastro diagnosed you with that is because they're doing a pathology test. The reason you got diagnosed with IBS is because they're doing more of a pathology-based test. They couldn't find pathology before, so it got its label, which is pretty standard. But what we're saying from a functional medicine perspective is we got now, even though we know what the pathology is or the diagnosis is, we still need to go back and explain and figure out what's that root cause or causative factors.
And IBS is a very good one actually to use, because IBS is definitely a diagnosis of elimination, and it's an umbrella. I call it an umbrella diagnosis because it's not really a diagnosis. It's just giving you a label because there's nothing.
We're labeling symptoms.
Yeah.
Not labeling the symptoms, yep.
Yeah, yeah, you're right. Labeling a symptom, because there's so many underlying causes of IBS in different people, and it's like, it's not really, it's not getting to the root cause of the problem. You're right. And I love that.
Yeah, and we do that with a lot of things, right? Like somebody has chronic headaches and they go and somebody says, well, you have migraines.
Yeah.
Okay.
Yeah.
Their doctor's like, I have this because I have a migraine condition. Yeah, but something is causing the migraines. And that's where, again, patients get so confused because, like, my doctor said this is a migraine condition and they just have to treat the migraine. And again, the functional medicine perspective is, I agree with the diagnosis. But if we're ultimately treating the diagnosis doesn't fix the root cause issues that address it. So that's really the core difference, I think, many times in functional medicine is we care a little bit less about what the official diagnosis is, and we care a bit more maybe about what that underlying cause is. And I don't know how, as the allopathic physician, you feel about that comment, but that's just my perspective.
Yeah, I think I agree. I think it's so important. I think, conventional medical, allopathic, I think they should be addressing the root cause as well.
And I think even when we're talking about thyroid physiology, to some degree, it's the same issue going on. Is we're waiting until a patient develops glandular exhaustion and then saying, okay, now it's time to fix. That is the allopathic perspective to hypothyroidism, that there really isn't a thyroid condition until the gland becomes dysfunctional that can be addressed. And in functional medicine, we're saying, listen, you're already having signs and symptoms of hypothyroidism because hypothyroidism really is a tissue issue where the tissues aren't getting enough thyroid hormone. And we want to intervene so much earlier in the process before the gland becomes dysfunctional, because there's so much that we can do to help somebody who's got chronic hypothyroid symptoms if we address the root versus just saying that, yep, I understand you have a hypothyroid condition, I'm going to treat that by providing more thyroid hormone. It's not that that doesn't necessarily work to make a person feel a little bit better, but that's usually rarely a long-term strategy to actually help anybody recover from a thyroid physiology problem or condition.
Yeah.
Erica, comment?
No, I think it's all, it's the way that the system is set up, and I think that there obviously work needs to be done, but I think part of it is the patient or the person seeking health, you know, looking for the right person and being open-minded. I think that's really where it starts.
So Leah, we're coming to the end of our hour. So I think one of those things is maybe that we can finish off with your recommendations, whether it's for the layperson who is, they've been frustrated in the allopathic model, they've learned about functional medicine, they're coming to their GP, and they want to kind of start having that conversation about maybe a functional medicine approach. What kind of recommendations would you give to the layperson so that they can have less of a controversial relationship with their GP as they want to start to integrate into maybe more of a functional care?
Well, I would say if you're a good practitioner and a good GP, then you should be open to evidence. And there's a lot of evidence actually in functional medicine and lots of papers. So I think as a patient, you could also read and gather that evidence, and whether it's a paper that you read or something that you read, then you can back it up and search for a specific study that correlates with something that you've learned as well. And bringing that in, or you know, sending it to your usual, you know, allopathic doctor, and actually they should be open to discussion, because as doctors we're taught to learn, and you know, new evidence becomes available. So you know, they are open. So I would say if you found a good doctor and you have a good relationship, then they should be open, and you shouldn't be afraid to discuss things with them, because they are there to help you and also support you, and it is your life and it's your health. So if you want to do both, then you should be allowed to do both avenues 100%, and they should support you, and you should be open with them as well to discuss that. And if they're not the right practitioner for you, then maybe you should look for another practitioner who is, and who's more open to discussion, because it's also about people connecting, and you know, you're not going to get on with everyone in this world either, so it's important that you have that good relationship.
Yeah,
Awesome.
I do think that that's very important, that if somebody's going to help you work through your challenges, you have to have a good kind of relationship that can be, you know, strong and open, and not feel like there's any sort of resentment between, you know, being able to tell them, or feel like you're going to get shamed. You know, if you know, patients are going to get off the bandwagon and they're going to have, you know, their cheat weekends, and I don't want them to lie about that. I want them to be honest with me, and let's figure out how we can address that the next time that situation comes up. And I think that that's really important to that working relationship.
Yeah, and I would say that it doesn't matter what type of physician, whether it's an integrative practitioner, an allopathic physician, or a functional medicine practitioner, you as the patient, it's your health, right? You should have a voice in what's going on. It doesn't mean that the medical doctor or the functional medicine practitioner or the integrative doctor is going to agree with what you want to do necessarily, but they should be accepting of, hey, if that's what you want to do, here's the pros, here's the cons. I don't necessarily agree that that's the right strategy, but my job is to support you in the decisions you make, and help guide them. But it really needs you, I think, for the most people, having a team of practitioners to help support you that are willing to have a conversation and work together is where we really need to go with healthcare in the future. I don't think functional medicine has it all figured out. I don't think allopathic medicine has it all figured out. I think what we really need to do is have more of a blend of integrative medicine, and whether that's an individual physician like yourself, or it is more just the idea that we are starting to integrate both kind of specialties. I think that's where we're going to get to. The sad part is we circle the wagon so often and everything, and we start shooting in, when the reality is that what's really, you know, kind of destroying our health is the poor nutrition. It's the toxicity of our environment. It's a lot of the things that we consume and surround ourselves with is what's breaking us down. And in healthcare, we're arguing about what's the best way to fix that instead of turning our attention outward and saying, hey, we need to clean up the environment. We need to clean up what we're cooking on, what we're cleaning with, what we're laying on at night, what we eat. We have to have a better mindset. I think we, instead of kind of butting heads against each other, they're bad, this is good, we need to look outside and say, hey, we can all work together to help people. If we've got tools like medications that we can use in a crisis, and then we've got a team of people that can actually spend the time with people and help them nurture their health back, not just manage a disease state, that's how we're going to change the healthcare crisis that we have here in the US and I'm sure in the UK and everywhere else. So Leah, so we'll just finish this up. If somebody wanted to learn more about you and about your practice, where would they go?
So I'm on Instagram, so I'm at Dr.Leah Austin, LeahAustin, and I've also got a website. It's called www.londonnutritiondoctor.com. So not all, just ignore the all one word, but londonnutritiondoctor.com. And yeah, I think that's probably the best way to find me. I am on Facebook as well, but it's attached to my Instagram account. And yeah, if you want to email me, you can email my PA at londonnutritiondoctor.com.
Awesome.
So pretty easy.
All right, well, I'll put your background and that information in the notes for the show. We appreciate you coming on the podcast and giving a little bit of your perspective. Dr. Erica, it was great seeing you again as well. And until next podcast, thanks to everybody. And for our listeners, we appreciate you downloading. Every month we have more and more downloads. If you have some free time, please go to wherever you download. I think there's like a star system where you rate the podcast. I think you want to go to like the 5-star and hit that and give us a nice rating and send us a nice note. And if there's anything that you want to hear more about on the podcast, you can reach out to Dr. Erica or myself. But with that, we'll sign off. You guys have a great day and a great weekend, and we'll all talk soon, okay?
Yeah. See ya.
Thanks so much. Take care.